We see clients with chronic pain all the time, and we use a variety of interventions and strategies when we work with patients with chronic pain. Very useful is to teach patients mindfulness skills, relaxation skills, activity monitoring skills so that there isn't a sense of doing too much at one time. When we think about the way patients with chronic pain think, it's very important to listen for catastrophic beliefs, predictions that clients with chronic pain make about what will happen in the future. So, for example, I worked with a woman with chronic fatigue syndrome recently, and she would avoid doing lots of activities, even things she liked very much, like joining her husband and adult children for dinner out, something that she truly enjoyed. And when we talked about what was going through her mind before the evening and how she chose to stay home, she was able to tell me that when she thought ahead about going to dinner, she had thoughts and images of herself being so exhausted that she wouldn't have a good time. She was willing to check her prediction. She was willing to go one night to see what actually would happen. I mean, we didn't know that could be true, or if she could get to the restaurant and maintain her level of energy, or who knows, she might even have a slight boost in energy because she was having fun. And interestingly enough, when she came back the next week, her prediction was wrong, and that she actually had a boost in energy once she was out and having fun with her family. And so one of the things to keep in mind when working with folks with chronic pain is to listen closely to their beliefs about their pain and what that means for them. Because sometimes their predictions and automatic thoughts are either not true or not 100% true. And we work really well with that kind of thing in cognitive therapy.